Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Ahmed Adam. You are welcome to this parasitology lecture. It is about intestinal flukes. The intestinal flukes are Fasciolopsis bascae, and this is known as a giant intestinal fluke, heterophyes, Metagominus yokogawi. These last two are the smallest human flukes. You see here the three flukes and their measurements. The diseases that they cause, Fasciolopsis bascae causes fasciolopsiasis, heterophyes causes heterophiasis, and Metagominus yokogawi causes metagonoiasis. So we start with fasciolopsiasis. This is the demonstration of the life cycle, and then we go to the description. The patient passes unembryonated eggs in stool, and if that takes place in fresh water, the life cycle will continue. Eggs become embryonated in water and release miracidia, which invade a suitable snail, and this is the first intermediate host. In the snail, the miracidia undergoes several developmental stages: sporosis, ridi, and lastly cercaria. The cercaria emerge from the snail and when they insist, are known as metacercaria. These are the infective stages. So the infestation will be on aquatic plant, and the aquatic plant is the second intermediate host. The infection in humans and the primary host. So human becomes infected by eating contaminated, let's say containing the infective stages, contaminated raw or undercooked aquatic plant, or drinking contaminated water. After swallowing in the duodenum, the metacercaria exist and release embryos. So the emerging embryos attach themselves to the intestinal wall, and they develop into adult flukes in about 3 months. The adult flukes lay unembryonated eggs, and the life cycle continues. I'd like to say that the lifespan of the adult worm is about 1 year. The clinical manifestations: most infections are light and asymptomatic. But in heavy infections, symptoms include diarrhea, abdominal pain, malabsorption, fever, ascites, anasarca, that is severe generalized edema, and intestinal obstruction or ileus. Ulcer or abscesses may develop at the site of attachment of the worm to the intestinal mucosa in the duodenum and jejunum, causing epigastric pain indistinguishable from that of peptic ulcer disease. So there will be peripheral eosinophilia, that to say there is eosinophilia in the peripheral blood, vitamin B12 deficiency, and anemia. In heavy infection, symptoms typically begin 30 to 60 days after exposure, let's say after infection. Systemic allergic manifestation in children are attributed to absorption of the flukes metabolites. Here, if the fluke metabolites are absorbed in the blood, they will lead to systemic allergic manifestation, mainly in children. Diagnosis, clinical assessment, the laboratory investigation, the specimen to be collected is a stool. A microscopic examination can reveal eggs, or less commonly adult worm, in stool. I'd like to mention that the eggs are indistinguishable from those of Fasciola hepatica, and this may lead to a challenge in selection of the drug for treatment, because in spite of the similarity of microscopically of the eggs of Fasciolopsis bascae and Fasciola hepatica, the drug treatment is different. Treatment: praziquantel 25 milligram per kilogram body weight 3 times a day for just 1 day. I'd like to mention that visual similarity of the egg of Fasciolopsis bascae to that of Fasciola hepatica can lead to treatment failure, because there will be treatment of a disease which is not that, where the latter is insensitive to praziquantel. That's why Fasciola hepatica is insensitive to praziquantel. Is treated by another drug. Prevention: improvement of personal and environmental hygiene, and not eating raw or undercooked fresh water plants or drinking contaminated water in areas where Fasciolopsis bascae is endemic. Then safe disposal of human and pig excreta, because pig is also a primary host. Then we go to metagomiasis caused by Metagominus yokagawi. And you see here, lower down, the patient passes embryonated egg. Here, embryonated, in contradistinction to that of the Fasciolopsis bascae. Here, the eggs are embryonated. If that takes place in water, the eggs are ingested by the snail, which is the first intermediate host, and this will lead to release of the meracidia, and the meracidia undergo several developmental stages: sporocyst, iridae, and ultimately cercari. The cercari are released in water. They swim for some time, and they penetrate the skin of fresh or brackish water. Brackish water is a water resulting from a mixture of the fresh water and sea salt water. And they insist in the skin or flesh of the fish. And here the hosts, including humans. So the other hosts, in addition to human, they are fish-eating mammals and birds. And after ingestion, the metacercari exists in the small intestine, and they reach adulthood and lay embryonated eggs to be passed in stool, and this will complete the life cycle. The clinical manifestations mainly symptomless, but occasionally in heavy infections that may lead to mild abdominal pain and diarrhea, and that the worm, it fixes itself to the villus crypts of the intestine, small intestine, and so there may be this may lead to localized eosinophilic inflammation. And rarely flukes eggs enter the blood vessels, a lymphatic producing distant granulomatous reactions. The diagnosis: metagonomesis is diagnosed by eggs seen in stool microscopically. Only after antihelmintic treatment, the adult worm can be seen in stool and then be used as part of a diagnostic procedure. Sometimes if you suspect and no eggs in stool, you can give Antihelminthic treatment like praziquantel and re-examine the stool. So, and you examine another specimen after treatment, you may find the adult worm. The treatment is a single dose, oral dose of praziquantel, 20 milligram per kilogram body weight, and the prevention is to cut the life cycle. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.